So I'm not the same woman I am before. A lot has changed physically, but it's all good, you know. It humbles you. This entire experience just humbles you. Teach you to appreciate the simplest things in life.
First, let me just say thank you for doing this interview. Is your correct name Carol or Vishwani? I see Vishwani on the screen.
Yeah, well, I don't usually use the Vishwani much, but people know me more by Carol Dabie.
All right. So I've already started recording, so we're just going to jump right into it.
Sure.
I know you mentioned that you did not want to rehash what had happened with your diagnosis and the years of using hormonal medicines to treat your symptoms that you were having. But I just wanted to know if you can just give me a brief overview of what had happened leading up to your diagnosis in 2019.
I had no pain or anything like that, so I didn't see anything wrong, but every time I go to the doctor, they would just put me on contraceptives saying it's imbalance of hormone.
All right. You mentioned that you started getting symptoms in your teenage years. Can you be more specific as to what age did it really start?
When I first saw my period, I think I was around 13, and at that time, it started almost immediately with the symptoms. But like I said, they said, when I get married, things would get better. So yeah, so it was pretty much my entire life. I have struggled with irregular periods. All they were doing is treating me for UTI, and then they did an ultrasound on the left side because they said the left kidney was swollen. Then they told me it was kidney stones, and that's when I met Dr. Brian Niles, the urologist. They referred me to a urologist, and I made an appointment with him because he was right at the hospital. So when I met with him, my brother was there with me, Terrence, and he was going through my entire medical record. He even walked over to the gynecologist clinic, collected my files, and he sat with me for almost 2 hours, and we discussed everything. And he said he don't think it's kidney stones, and I should make an appointment at the Cancer Society in Guyana. I'm not sure the correct name, sorry, I can't remember. To do a CT scan with contrast. So we did that, and that's when they discovered the mass.
Can you explain or tell us about how does chemotherapy and radiation affect your body, and how has it been for you?
It has been a struggle because the part of your body that is being radiated is the pelvic area. And I already had bilateral kidney stents inside of me, and the cancer did spread into lymph nodes, so they were also radiating my thorax area, so it caused some effect to my stomach as well. So I had horrific side effects in terms of I was in an adult diaper for almost 6 months. Not that, I had to get help like changing like a baby or things like that. It's just that I did not have no control over my bladder, my bowel, and even my stomach.
And can you tell us a bit about your support system? How have you been managing to get through all of these times?
I did had a lot of support. Yes, when I first came over, I had a family that opened their arms to me, opened their doors to me, provided me with everything I needed. And unfortunately, when the pandemic hit, the woman I was staying with, her son contracted the virus and he died. During the entire pandemic, I was hospitalized in the midst of everything. Thankfully, I was never tested positive, even though I was surrounded by it. They did try their utmost to keep me safe, and they did. And because of the prolonged treatment and pause in treatment, the cancer spread into the lymphatic system. Like I said, cancer was easier to deal with than all of these external factors, and the pandemic was mainly one of the reasons that really made it difficult for me. The cancer that I have, clear cell carcinoma, it's incurable, but it is treatable for how long? As long as my body can take. So basically, they're just extending my life, hopefully, because of advanced treatment. Maybe a miracle can happen. They do call me a medical miracle, so